Hi, my name is Jacinta Frawley, and I'm welcoming you here with my colleague Jill Stannard to talk about Ovarian Cancer Awareness Month, and in particular, the research and research funding around ovarian cancer. Jill, do you want to say a quick hello?
Yeah, I'm a lucky long-term survivor. I'm a product of early detection and treatment, which is why I'm here 12 years on. And Jacinta, you've filled in your backstory before, or you want to add a little bit more?
Well, I'll just pick up what you're saying there. I'm actually did not benefit from early detection. I'm more the 70% of women that are diagnosed in stage 3C and later. But I too benefited tremendously from research, which is UK-based research. And I was one of the first women off trial in Australia back in 2020 to receive the first of the new what we call PARPs, a particular type of oral
Mm.
medication. So I'm not trying to be too dramatic. I am certainly only here because of medical research. And, you know,
Mm.
that is just so important. Over half of us die within 5 years. And, you know, how is that good enough?
Yeah. And
Yeah.
the other thing that we've both done is both trained to be what's called a consumer in research, which means we kind of represent the coalface working directly with researchers in many universities and institutions in Australia so that the patient, the person who has ovarian cancer, is at the forefront of all researchers' minds. So we're really what we do is really impacted by funding. Now, you've
Mm.
just come back from Canberra for the
Yes.
OCA parliamentary breakfast. So, what was the takeaways from that, and what spurred this particular um, video today?
Okay, thanks, Jill. So Jill and I are speaking to you and hoping that you're listening today, basically because I came back from Canberra absolutely enraged. Um, there was a spectacular breakfast, OCA, these women talking about losing their mothers, their sisters, their daughters, husbands there who'd lost their wives. Um, and lo and behold, we discover, and this was absolutely outrageous, that the Australian Medical Futures Research Futures
Medical
Fund,
Medical Research
whatever
Future
it is,
Fund,
I'll put all that in the bio,
MRFF.
in the
That's
link, which was promised to us to deliver $1 billion Australian. So just imagine $1 billion Australian in research funding every year for everything, not just ovarian cancer, obviously. That has been spending less, that has had an artificial cap from the time of the previous government. That artificial cap is something just under 700 million. And what that means is just using the interest, which, eh, sorry, I've to start again. That fund, just I'll hold your socks here, has got $23.18 billion in it. Less than half, I think less than a third of that interest is being spent. And we're here supporting Dr. Monique Ryan, who's an independent member for Kooyong, where neither of us live. We have no association with her. But she has started and she's been prosecuting a campaign that our current government release the funds that were promised back in 2015. Now, currently for ovarian cancer, anyway, the most lethal of the female cancers, we still get less than 1% of that funding. So I just want to say less than 1%. So all gynae cancers get about 2%. So but only half of that money is being released anyway. So we're not even getting what we should be getting. Um, we can, the government could immediately release something like 1.06 billion per year and not touch the capital. Now, I think why don't they still spend the 23 billion anyway? But anyway, okay, I'll leave it
Mhm.
to the accountants. So really, if you want to do anything, the most effective way to help your health today is to look at the hashtag, which I'll somehow manage to put in here, which is medical research matter. Um, go on to the email campaign, and it'll take you 30 seconds, and you can fill it. You can just hit it and let it go as it is, or you can put in something personal. I, of course, wrote a novel. And that is going to the health minister, to the prime minister,
Mhm.
who in the past has actually been very supportive of some of our colleagues uh, who are seriously unwell. Um, we have ovarian cancer, our community. Today, we've just been talking with two separate friends of ours who are in the midst of a recurrence. Now, they have very few options. And we don't die so quickly because it's such a difficult disease. We die because our funding is so minimal. So please, whether you care about ovarian cancer or not, please take your 30 seconds and fill it in. And if you care passionately about something else, put in that, fill it in for that.
This is
This
all
is
medical research.
for,
It is everything. So
yeah,
everybody's life is touched by health
yeah, it's,
condition at
it's
some point.
medical health. So sorry, Jill, it's mental
Yes.
health. It's
Yeah. Mm,
dementia. It's
mm,
MS. It's way
yeah.
beyond cancer. This is your money. This is
Mhm.
taxpayers' money. And I just want to say that again, $23.18 billion in that fund. I mean,
Mhm.
yeah, what's it doing there?
There
We,
is there
yeah,
is so much amazing research, and we're talking because we know intimately by working with researchers in our particular field that will change lives.
yes,
But it just goes nowhere because it's not funded. Philanthropic funding, it's problematic, and we should
yeah,
never rely on that. We pay tax so that people, any person with a health condition, can benefit from cutting edge research. So that's right, medical research matters.
yes. So please, I will put the link somehow magically, however happens in social media. The hashtag, it's hashtag medical research matters. If you can't follow my instructions, Dr. Monique Ryan's website is available. And there's lots of support from other politicians, but this is not political. This is about justice for the
Yeah.
Australian population. And beyond that, Australia is a world leader in medical research. So not only if we're doing it for ourselves, we're doing it for all of, yeah, well, certainly,
Well, to
certainly all the
stop the
South
brain
Pacific
drain,
and,
to stop
and
our
New
researchers
Zealand.
having
Yes,
to leave the country. This is
absolutely.
the reality. It is heartbreaking watching amazingly experienced researchers just scraping for money to keep their labs open and keeping people employed, let alone do the work.
And
So
keeping us
Jacinta,
alive.
Jacinta, it's a really, really important issue. Thanks
Yes.
for raising it today.
No worries. Thanks so much, Jill. Thank you for offering the support and the technical support of a Zoom meeting. Please follow up on this. If you don't want to deal with a different member of parliament, write to your own member of parliament. They've got nothing else to do except what their constituents ask them. You take good care of yourselves out there in social media land, and medical research matters.